Hello, my name is Fergus Timmins, and in this short presentation we're going to look at some of the causes for responsive behaviours. So as we've already looked at in this topic, responsive behaviours or challenging behaviour are behaviours that challenge us as carers. There are behaviours that we find tough, testing, taxing and/or emotionally draining to deal with. Now, it's important to remember that these behaviours may not pose a problem for the person with dementia. It's highly likely that the person is not intentionally being challenging. So it might seem to you that this behaviour is almost put on. It's not. It's behaviour that we need to seek an explanation for. Okay, so what are the causes of responsive behaviours? Well, there are a number that we want to look at in this presentation. Communication may be an issue, and in fact it might be the main issue. And by communication we kind of mean that the inability of the person with dementia to communicate as they used to can be highly frustrating for them, and it can lead to them suddenly changing the way they behave out of sheer frustration regarding their inability to communicate. So we also talked earlier on about communication and non-verbal communication and body language, and that's the other side of responsive behaviours. If your loved one with dementia is in pain, you might be able to spot that by looking at their body language, and particularly maybe they're frowning or grimacing, and that might indicate that they're in pain. There's also the possibility of concurrent physical problems. So it could be that the change in behaviour is a result of the person with dementia feeling constipated, having sensory impairments, infections, and possibly even side effects to medications. So with these are more physical and they're more clinical, and perhaps some advice from a doctor or GP would be useful in this situation. Or if you suspect there are concurrent physical problems. Stress is a major cause of responsive behaviours, and we're going to spend some time now in the rest of this presentation looking at stress and possible causes of stress. So we're looking at some academic literature here in terms of the possible reasons for changing behaviour. The shrinking of the comfort zone. So the person with dementia is no longer comfortable in their situation, and that is stressful for them. They have a lower threshold to stress. So the build-up of frustration and lack of ability to communicate can build up over time and can lower the threshold to stress. Excess disabilities, well, together with dementia, there might be other disabilities and physical inabilities that can contribute to changes in behaviour. A feeling of loss of independence is important. The person with dementia might feel that they have lost part of themselves, and of course they can't communicate this very well to you, their carer. It may be that they feel that the care that they're receiving is overly paternalistic, and that can lead to stress and changes in behaviour. And of course we're going to look at the other stress-related responses in the rest of this presentation. So the environment can be a source of stress, and by the environment we mean the care environment, so your home, the room, and really we're looking here at multiple competing stimuli. So it could be that the radio is on, the TV is on at the same time, you're having a conversation with the person with dementia, and all of these together contribute towards a possible stressful environment for the person with dementia. So too many people talking at the one time can also be stressful. So, and too many things going on at once, eating dinner, taking medications, news on the radio at mealtime, that can be very, very difficult for the person with dementia. Bearing in mind that some people with dementia will feel, might suffer from other ailments, including hearing and sight, and I suppose this is particularly true of people in the later stages. So just be careful about the environment and examine the environment that you're providing care in, and make sure that there isn't too many competing stimuli. Another source of stress could be physical stress. So it could be side effects towards medication, general discomfort. If somebody's sitting for a long time in the one place, it can be uncomfortable. Fatigue, people mightn't be sleeping well and properly, and that might contribute towards tiredness. They might be hungry, they might have a cold or flu, they might be thirsty. We're going to look at some of the issues around nutrition and eating well in a later module on the course, but thirst and hunger are potential causes of physical stress. So make sure you monitor that well. Of course, another source of stress potentially is the changes in people's lifestyle. So you, the caregiver, are passing through many different stages as a carer, and that's a huge change for you compared to what you were doing in your earlier life, and that can transmit itself sometimes to the person with dementia. A change in routine can really upset somebody with dementia. It can be a great idea going for a holiday or going on respite, but then when they come back, when the person with dementia comes back to their original environment, they can feel a bit put out and things can feel strange again. So breaking routines is good, but you have to be careful that and appreciative of the fact that it can lead to changes in behaviour and a little bit of confusion and other factors for the person with dementia possibly. So we've talked about the environment, the external environment, noise, confusion, stimulation, overstimulation and too much noise and too many things going on. That can certainly be stressful. And then the internal environment, I suppose, hunger, pain within the person with dementia. So it's important to look at those as well. Other sources of stress: demands that exceed abilities, decisions that are too complex, and tasks that are outside abilities of the person with dementia. So make sure that you're not overly expecting or having too many expectations of the person with dementia. Work with them and work within their abilities and capabilities. And be careful in terms of your communication, in terms of feedback. Negative and restrictive feedback can be understandable from your part with your frustrations from time to time, but it can have an impact on the person with dementia. So being negative and some of those statements there, I'm sure you don't use them, but being overly negative can be stressful for the person with dementia. So just be careful about that. Pain, of course, is a source of stress. So it's essential to understand that each individual with dementia has unique ways of communicating pain. So this is where your non-verbal communication skills are important. So pacing, guarding, facial grimacing, excessive sleeping, or even not sleeping during the night could be symptoms of pain. And just monitor that as best you can. Because untreated pain can lead to behaviours which challenge, including pacing, shouting, lashing out, cursing, poor mood, anger, sleepless nights and erratic behaviour. These are all behaviours which challenge us as carers. And of course excessive tiredness and decrease in exercise tolerance, that may also contribute to the progression of dementia. So just be careful and monitor people's pain if you can. Also, so we've looked above at some of the sources and explanations for and causes indeed of responsive behaviours. What we're going to do for the rest later in this module is look at trying to find out and isolate what's causing the changes in behaviour. So, and this is where you come in. So it'd be useful to generate as many possible explanations for behaviour as possible and involve the rest of the family or other carers, people that are in contact with your loved one. So we're going to look at some models about this below in the next section. Eliminate only those explanations which, beyond all doubt, don't apply, and investigate those ideas that remain. So gathering information through a range of assessments, including biographical, environmental, behavioural monitoring, etc., can be really, really helpful in seeking explanations for the particular issues that cause responsive behaviour in your care situation. And then test those explanations that are viable, trying each in turn to see if a resolution occurs. So we're going to look at this in the next section. Basically, we're going to give you some tools to try and seek out the explanations for your loved one's changes in behaviour. And once you have those and find out which triggers, I suppose, lead to changes in behaviour, then you can address those and avoid those triggers as much as possible. Okay, that's the end of this short presentation. I hope you found it useful. Thanks very much for watching and listening.